Hi, my name is Ella Poultney. It is February 1st, 2026, and it is 3:45 p.m. So, my presentation is on hemolytic anemia. So, what is hemolytic anemia? Hemolytic anemia occurs when red blood cells are destroyed faster than they are produced. Therefore, red blood cells cannot carry enough oxygen throughout the body, leading to weakness and fatigue. So what happens on the cellular level? Here I have some pictures, which I'll explain right after. The membrane of red blood cells is structurally changed, making the cells more fragile and likely to rupture. So over here, before any treatment, this is what your cells will look like. See how they're more rigid and not circular? Those are the cells that are affected. And after treatment, you can see that the cells are more rounded. There's less cells with these bumps and structures. And that's what you're trying to aim for, is a healthier body. You want less cell destruction. So what is the damage? Damage to key pathways including glycolysis and the pentose phosphate pathway. Damages enzymes including glucose 6-phosphate, dehydrogenase, and pyruvate kinase. So basically everything in the path of this blood cells being produced and made is being destroyed, and the cycle is not being able, or the lifespan is not able to be completed. So what functions and organs are affected? So the circulatory system, the body, is the main body system affected. That is what allows blood to move through the body. The main function affected is the oxygen delivering gets affected, causing the muscles, brain, heart, all to have problems. All of this leads to weakness, shortness of breath, headaches, and cognitive issues, which is something you really don't want. Organs, the main organs affected are the spleen, liver, and heart. The spleen is what stores a lot of your red blood cells, so that organ is really affected. What healthcare professionals can help you? There are many healthcare professionals out there that are willing to help and want to help you. So here are a few that I compiled to show. So a hematologist is the main specialist for the disease. That's who you will see every time you go to a hospital, or your specialized doctor to help you. A nurse, that's the one who's providing the care, giving you medications. Maybe you're going through dialysis treatment. They're the one who's there for you. The primary care physician, your PCP, those check on you periodically. Usually you have checkup once a year. They're just making sure everything's okay with you. A dietitian, they help you with meals, meal planning, meal prepping, making sure you're eating the right foods to help you help fight the disease. A pharmacist, they're the ones who are giving you your medications, making sure everything's okay, making sure the medications aren't messing with you too much. And the genetic counselor is someone who helps families with hemolytic anemia, because that can be passed down. So just making sure that everyone in the family is okay and they don't need to start treatments either. So the hereditability. So is hemolytic anemia heritable? Yes, it is. Hemolytic anemia is a heritable disease, and it is the mutation in the red blood cells. So it can also be developed later in life from mutations due to autoimmune disease or infections. So not only is it heritable through your genes from being passed down, it can also be inherited later in life, or not inherited, but more developed later in life with other diseases. A lot of them can be from diabetes. So that's one to look out for if you get diabetes, to also look out for this. So patterns of inheritance. Hemolytic anemia is a sex-linked trait that is recessive. So you could be a carrier and not show the disease, but a lot of people who have the disease show it. Other than that, it can be gained later in life or passed down to the next generation if you are a carrier, as I said. So failures of the red blood cells. Blood cells have a lifespan of 120 days, and the failure occurs when the blood cells do not make it through that 120-day cycle. Two ways that this can occur is intravascularly, which happens within the blood vessels, and extravascularly happens outside the red blood vessels. And this is just another picture showing what it looks like in your body with these cells, because the other picture was very far away. So this is just really up close. We can look at how these ones over here look pretty normal, round, circular, and these ones and this one. I believe this one is actually sickle cell, which is a form of hemolytic anemia, but you can see that a lot of these do not look well, which is not what you want. So lifespan habits and epigenetic factors. And here's a red blood, like a pathway. I just want to show a normal pathway and what it would look like for the blood to travel through your body. So starting off, we have food. Certain foods that are a part of a poor diet can lead to your body not having the strength to replace red blood cells. So making sure that dietitian is very helpful, because you want to make sure that you're eating the right foods, and certain foods can really affect how your body is working, so you really have to make sure you keep up with a healthy diet and make sure you're eating all the food groups. Diabetes. G6PD is an enzopathy, and it is one of the causes of hemolytic anemia. So as I said earlier, it can be passed down through hereditability, but also diabetes is another big cause, and it goes hand in hand. So if you get diabetes, you're not always going to have hemolytic anemia, but it is a possibility. Toxins or chemicals. When exposed to certain chemicals unprotected, it could lead to your body failing its cell processes. As you know, like unexposed radiation or some of these things are not good for your body at all. So making sure that you're always having protection when you're going certain places with very strong radiation or chemicals or something is good, to make sure you don't develop anything, hemolytic anemia, and also just anything in general. Infections. One infection that can lead to hemolytic anemia is HIV. And an autoimmune disease is rheumatoid arthritis, which is something I learned that can happen when you get older and something you have to be careful for. So what are the genes involved? So there are 37 different genes involved with hemolytic anemia. Some of them include ABCB6, AHSP, AK1, ALDOA, ANK1, and BCL11A. And over here on the right, I have some pictures. One of them is ABCB6, which is up top over here, which I'm not really sure if my face is covering. I hope it's not. And ANK1, which is over here. Sorry, I'm messing that up. But these are just two different ones. They look very different, but just making sure those are some of the genes involved. And you may look very big here, but they're just super, super tiny in your body, and that can really affect if you have this disease or not. Gene expression. If you're born with it, hemolytic anemia is caused by a mutation in the DNA, because there are two ways it's done. It is inherited from mother to offspring, or just inherited down the line, or it can be developed because of something that you have that has happened to your body or something that has occurred. So it can be acquired as the disease progresses through your body. So you really have to be careful with your diet, and if you have diabetes, again, just making sure you're keeping up with everything to stay healthy. So next up, we have therapy and treatment. So transfusion, medication, and disease-specific drugs are kind of the main things. And over here, we have some more specialized things that could be done. So immune system suppression, which stops the body from destroying red blood cells. So you really are just trying to help your body so it can really go through that 120-day cycle. Prevention of iron overloading. It helps with the prevention of organ damage, because you really want to make sure everything's intact, especially with this disease not being able to transport blood through your body. Replacing blood loss or blood transfusion. You want to add the healthy blood so oxygen is carried through the body, because having hemolytic anemia, your body becomes weak because oxygen is not able to flow through your body. Another thing is a splenectomy, which is red blood cells are mainly destroyed in the spleen. Having a splenectomy would help raise your red blood cell count, because the spleen is where most of this is happening. So making sure that if you remove that organ, which you do not need fully to survive, you could use it, but it's okay if you don't have it. So having that removed actually can help your body function if you have hemolytic anemia. How can you be diagnosed? Some ways to be diagnosed are blood tests, blood smear, urine tests, and genetic testing. There's a genetic test for the disease called NHHA. It's a blood test known as the Hereditary Hemolytic Anemia Gene Panel. And you really just, if your family has it, you really need to get tested just in case, and make sure that everything's healthy and you don't have it, or you don't express it. So preventable technologies. There are really no preventable technologies available. There's no cure yet. Doctors are working every day to try to find a cure, but there's really nothing that they can do right now. There are treatments, of course, and clinical trials happening, but nothing really could cure it as of right now. So the outlook, continuing on, there are many clinical trials, as I said, to help patients find a cure or even a little bit of pain being released, because this can be very, very painful. One of these in trials looks at T cells and is looking at B cells. So over here I have a picture of T cells and B cells to show what those look like. So T cells are what help B cells stay in line. They help the immune system, so red blood cells can be complete in their 120-day lifespan. And then these are my sources. Thank you.